Strokes are very, very prevalent in our community. Strokes affect all of us in one way or another. However, there are factors which contribute to one's having strokes, and there are policies and procedures and methodologies and preventive measures that one can take in order to prevent it. Matter of fact, I understand that there's a simple formula or approach called FAST.
That is correct.
That one can use that kind of alleviate the pain and the possibility of stroke. Well, I don't know all about strokes, but I've got somebody with me today, who does. Two individuals, as a matter of fact, in the person of Miss Denise Goins and Dr. Matthew Smith. And what we want to do today, since May is National Stroke Month, we want to talk about some of the particulars of strokes and how they happen, why they happen, what one can do to prevent it, what are the treatments for it, etc. This is a call to action.
A call to action.
I'm your host, Alex Havisham. I'm going to say it again so Dr. Smith can get in on time. This is a call to action.
A call to action.
I'm your host, Alex Havisham, and I'm more than a little pleased for a couple of reasons. First of all, to be addressing an issue that's extremely important to our community and to health and our long life and things of that nature. And secondly, because I've got two people here who have experience and training and what have you in it, who can impart information. And the reason I asked them to repeat a call to action is because that's what we are desirous of as it relates to the imparting of this information as it relates to stroke. But first of all, just personally, tell us a little bit about yourself. I'll start with you, Ms. Goings.
I'm a stroke certified registered nurse, and we've been very active in the stroke community for about 11 years now. Been a nurse much longer than that. But our program is responsible for making sure that our hospital is up to date with the most current clinical practice guidelines. We make sure that the physician's orders reflect those most current clinical practice guidelines, and that all of our patients receive the best standard of care that's out there for stroke patients.
Dr. Smith.
Okay, a little bit about myself. Originally from Memphis, Tennessee. Went to med school in Memphis. Did training at William Beaumont, which is in El Paso, Texas, aviation medicine in the military. Served 3 years active duty after doing my initial training in the military. Got out, did neurology residency at University of South Florida, then did fellowship in vascular neurology at UNC Chapel Hill.
Right.
After finishing fellowship, this would be my first job.
Oh,
and I've been here for 6 years as a medical director of stroke at Navicent Health.
Right, outstanding. So let's talk a little bit about stroke. We're going to talk first about what are the conditions and the behaviors that could possibly lead to stroke, whichever one of you want to address it.
We'll probably double team this.
Okay.
But one of the biggest things that's really prevalent in African American society is high blood pressure and diabetes. Those are two of the biggest controllable risk factors you can have for stroke. Obesity, being overweight, high cholesterol, smoking, any drug usage, all those things also contribute to stroke. And most of those things are modifiable, meaning that the patient could actually do things about them to prevent a stroke down the long term. Some people actually have a genetic propensity to have stroke as well, but they can't control that. And it is a little higher in African Americans, the genetic propensity to have strokes as well.
When you say they can't control it, you can't control the genetic propensity, but through your behavior, can you control the possibility?
You can control the possibility by modifying behavior, by staying active, having a healthy diet, going to the doctor, getting your blood pressure checked, taking medication if you have high blood pressure. You have problems with your diabetes, making sure you check your sugars daily, make sure that they stay at the proper levels. These are all controllable things that they can do on top of that, which will decrease their risk for having a stroke long term.
Okay, what are the treatments? And we're going to talk more about prevention, but take us through the treatment procedure
Well, the
If you
first
will,
thing
what's going on?
we want is we want patients to get to the hospital quickly, and the FAST that you mentioned earlier is very important. The F stands for face, and this is something you can do on yourself, or you can do it on someone in your
Okay, now I'm
family.
gonna walk through these slowly.
Exactly.
Because
Okay.
if in
This is very
fact,
important.
you know, cause I know the word fast,
Yes.
but I don't necessarily remember what everything.
She's a fast
means.
expert. Since she's gonna break it down for you, I'm gonna chime in a little bit.
I'm gonna-
I'll break it down for
Yeah,
you.
that's why I want it broken down, because not only for myself, but for other individuals in the community, we need to, kind of keep that in mind, like we need to remember that, like we remember the post what I ate today on Facebook,
Exactly.
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 So the F stands for face, and what we want someone to do is to smile, to see if there's a droop in their face. Sometimes people describe it as a twisted face.
Or any
Or-
asymmetry.
Yeah, you want to make sure that it's equal. And then the A is for arms, and you can put your arms out in front of you, or you can reach for something. You want to make sure that that arm doesn't drift or fall down. And then the S is for speech, and you can say something simple or quirky like you can't teach an old dog new tricks, or you can say a whole sentence. It's important that you say a whole sentence, not just one or two words, because we want to make sure that the words are coming out clearly, that they're not slurred, and that they're appropriate, that it's the appropriate word. My address is, or my date of birth is, and that all of those words flow very smoothly. And then the T is for time, because the quicker someone gets to the hospital, the quicker we can evaluate them in the emergency department and determine whether or not they're a candidate for either TPA, which is our clotbuster drug, or for an intervention that Dr. Smith will talk about.
Okay, now, so you're saying that if one becomes suspicious that he or she is having a stroke,
To immediately call.
then
Immediately.
but what I'm saying is what drives fast. I mean, I don't get up every morning and do fast. So when
Right. Well,
when is it applied?
We're talking
Does that
about
make sense?
sudden.
Yes.
Exactly, and that does make sense. And we're talking about sudden
Sudden
changes.
changes. Sudden changes,
weakness
exactly.
in the face, the arm, the leg, sudden confusion, sudden trouble speaking, sudden trouble with your vision, sudden trouble with dizziness or difficulty walking, falling to one side.
Yeah, even though those aren't in the FAST program, but those are all signs of
Okay,
a
I
possible
understand.
stroke.
I understand.
So anytime you have a sudden change, it's always better to come to the emergency department at Navicent and let us evaluate you, because patients can have what we call a TIA, or a transient ischemic attack. So they may have those symptoms, and then those
They go
symptoms
away.
go away, and people disregard them. But that is a precursor to a stroke, just like angina. You hear people that say they have angina
chest
or
pain.
chest pain,
Yes.
is a precursor to a heart attack. TIAs are precursors to stroke. So we always want you to get to the hospital.
One of the most common things I see is people's like, oh, I'll take an aspirin, I'll be fine. Or I'll see if it'll go away. In this aspect for a stroke, because every minute counts with this. The fast, we are able to deliver certain medications, and there's certain procedures we could do for stroke. 20 years ago, there was nothing that we could do for stroke. Remember, people would come in the hospital for a stroke, and we would just watch them say, hey, you had a stroke, we can't do anything for you. But we now have a medication that we developed about 20 years ago, which is called TPA, which she alluded to. And if you come in within 3 hours of having those symptoms onset, we can give you that medication, and you have a better prognosis long term. We say 30% of people get better from the medication at 90 days. And this has been proven by multiple studies that this is the case. So you're talking about a huge benefit. And we also gone back and done studies after that and showed the people who get the medication faster, they have even better prognosis than those who get it later out to the 3 hour window. The normal window to give the medication is from 0 to 3 hours. So you still have to be fast. However, we were able to expand the window about 10 years ago to 4.5 hours for certain people. And this is for IV medication. Now we're on the cutting edge that not only can we give the medication, for the bigger strokes, we have neurosurgeons who could actually go in there, go in through the groin, and actually take the stroke out. Like remove the blood clot that causes stroke.
Okay, let me interrupt you. Because I was just going to ask you, what causes a stroke? We're talking about the symptoms, but medicinally,
Yes.
or biologically, what happens in the body that produces a stroke.
Okay, so there's two types of strokes.
I'm with you. I'm ready.
Okay, the first type of stroke is what we call ischemic. That means a lack of blood flow. Meaning there could be a blood clot or one of the blood vessels closes off and causes a lack of blood flow, which causes the tissue to die.
Okay, all right. So that's why people say you need to be careful with cholesterol, because could that be a factor?
Well, cholesterol.
I know that, but I'm saying that if you got your arteries clogged.
Well, yeah, it's similar nature because
I
cholesterol
tell you what I'm
causes
gonna do.
plaques.
I'm gonna let you be the doctor. Go ahead.
Well, cholesterol causes the plaques. Those plaques can break off and cause that stroke. as well. Yes.
Okay. All right.
And that accounts for about 87% of all the
87%.
strokes. And 80% of those are preventable.
Okay. Now you said that what begins with cholesterol and then results in what's called plaque or what?
Well, the plaque could break off and cause a stroke, and that's one of the
cholesterol
ischemic
is the material.
cholesterol builds up in the plaque or in the blood vessels.
Right.
The blood vessels where the blood flows through.
Right.
So the cholesterol can either pile up and cause a plaque, which can break off and block off the artery away,
Or
it
the
can
plaque is
or it
a
can
piece
cause-
of a plaque is a piece of.
It's usually a piece of cholesterol.
Okay. Okay.
And it gets under the vessel and it causes it to close off, but it can sometimes break off as well.
Okay.
And flow upstream, which can cause a stroke.
Okay.
Either way, it can cause it to close off, or it can break off and cause a stroke farther upstream.
Okay.
So it can cause strokes two ways, the cholesterol, yes.
So when cholesterol builds up in the arteries, it builds up kind of like mountains. It's very
Okay.
mountainous, so it has sharp points to it. So as the blood passes over those, pieces of that plaque can break off, just like the tip of the mountain would break off and go up to your brain, and that's what causes the stroke. That's one of the reasons. That's not the only reason.
Imagine, well, you could also imagine like a water hose. Like if you squeeze it really tight at one end, then the flow doesn't go in that up high. So that's one way it can cause a stroke, or it could actually break off and cause a clog on a smaller
Wow.
vessel.
Wow.
Yes.
Yeah.
When Dr. Smith is talking about those ischemic strokes, we have almost 800,000 strokes a year. Someone has a stroke every 40 seconds. Someone dies every 4 minutes.
It's
So-
a leading cause of disability
That's
in the
right.
United States, period,
And
and
so-
in Georgia.
And when we say 87% of that 800,000 strokes are ischemic strokes, and 80% of that percentage is actually preventable. So over 500,000 strokes are preventable every year if we just modify our risk factors.
Okay. Let's repeat those risk factors.
Hypertension would be one, which is high blood pressure,
Hypertension. Okay. High blood.
high cholesterol,
High cholesterol.
diabetes,
Diabetes.
smoking,
Smoking.
obesity,
Obesity.
and there's a few more. You think
Lack of
exercise.
Lack of exercise. Diabetes and hypertension are probably the two highest in the state of Georgia. Patients that are diabetic are with a normal hemoglobin A1C. That's the test that tells us how their blood sugar's been doing over 3 months. If they have a normal hemoglobin A1C, they're about 4 times greater risk of having a stroke. If they're out of line, like up in the 10s or 11s, which is pretty high, that's 10 times greater risk of having a stroke.
So even if you're normal, that's if you got diabetes.
Correct.
Yes.
You're
So
still at risk.
you're still
at a high
at
risk.
high risk, but you can make your risk closer to somebody without diabetes by having well control.
Yes, controlling
By
that blood
controlling your
Correct.
your diabetes.
And while we were talking about like how big disability is, yeah, Georgia is right in what we call the middle of the stroke belt.
Oh God.
So the potential here is like 30% higher than the rest of the nation for an amount of strokes. So we see 30% more strokes than somebody would see in like Arkansas. Because us, North Carolina, South Carolina are all part of which we call the stroke belt, which is, like I said, 30% higher risk for stroke. And that's a lot to do with lifestyle. But
Okay. Like those things that you mentioned, exercise and smoking and
Good,
diabetes
and diet also plays a role too.
And then-
Okay, well, we're going to take a break right quick, and we're going to talk about some of the results of a stroke, like where one is impaired, the kind of impairment it causes, and other factors which could contribute to you not being one of those statistics and you're not having a stroke. This is a call to action.
A call to
I'm
action.
your host, Alex Havisham. I'm interviewing Nurse Goins and Dr. Smith. Matthew.
Correct.
That's correct. We'll be right back. We're back. This is a call to action. I'm your host, Alex Habersham, and I'm more than a little pleased to be interviewing these two medical professionals in the person of Nurse Goins and Dr. Smith, both of whom are very, very versed and knowledgeable about strokes. And I'm just so happy to do this because, like everybody else, I'm concerned not only as an individual, but as it relates to the community about strokes. And we've just got some very, very alarming statistics as it relates to the incidences of stroke and us being in the stroke belt in Georgia, which means that we're more likely to have a stroke. So the objective, of course, of this interview today, and then what I would suggest that you do, and Nurse Goins is going to, and Dr. Smith is going to give us information as it relates to follow-up, but I suggest that you see to it that your family members and neighbors and friends and church members get access to this interview, because the life that you save could not only be yours, but it could be somebody's that's close to you. Now, moving right along. Okay, you talked about two kinds of stroke, so let's very quickly give those terms and kind of describe the difference in the two.
Okay. We said that there's about 800,000 strokes a year, and about 87% of those strokes are ischemic strokes.
Spell that.
It's ISCHEMIC.
Ischemic.
Good thing I'm good at spelling.
Yeah, I'm sorry, I was trying
And that is when it's basically an interruption of the blood supply. Like you have an artery and something clogs it up. It's just like when you get, when you clog up something. You clog up your garden hose with a rock or a pebble or something. An artery in your brain gets clogged up. The other 13% are what we call hemorrhagic strokes, and that could be caused by two types of strokes. It could either be from an aneurysm ruptures, and that occurs in your brain. Those are called subarachnoid hemorrhages.
Which that's the lowest possibility of stroke. That's the lowest one, and most people do not have control over that, except for like high blood pressure control.
Right, and then the other part of the hemorrhagic stroke are what we call intracerebral hemorrhages, and that's when a tiny blood vessel in the brain bursts. And of course, the most common cause of that is high blood pressure. So that's why we really stress to our audience that it's so imperative that you take your blood pressure medicine. We a lot of times have patients that'll say, "Oh, well, I quit taking my medicine because my blood pressure was normal." Well, your blood pressure was normal because you were taking your medicine. So you need to continue. Well, you would be surprised. You need to continue taking your medicine and taking it regularly, and know your numbers. Get your blood pressure checked regularly and know what your blood pressure is.
One of the things I often see in our hospital that African American males will not take the blood pressure medication because they can't get it right. Perform. And it's multiple drugs. That's not always. It might be certain drugs that can do that, and that's when you go to your doctor, you talk to him about it and say, "Hey, this drug's causing me not to be able to perform. Can you switch it?" Because a lot of ones don't have that same side effect. Well, we need to say it, Doc,
because when you say perform, we're talking about erectile dysfunction.
Exactly.
We need to say it because, I know it's important as it relates to our manhood.
Correct.
But then, I guess having a problem with manhood is better than deadhood. So
deadhood, or not being able to walk hood, or not being able to eat hood.
So, but you're saying that not all medication necessarily adversely affect
your manhood or your erectile dysfunction. Erectile dysfunction, correct.
Dysfunction. Okay, now we talked about that. So, well, what happens to one's body? What are the particular results of having these clots? I know I see some people get paralyzed or what have you. Just talk about the different types of effect that
It could be tons of different effects, but the most common effect from a stroke is weakness on one side. So inability to use one's arm or leg, which would affect everything from eating to walking. Another big common problem we run into is swallowing, which is one of the biggest hurdles we run into the hospital, which people don't realize how much a luxury that is. Like, until they have to say, hey, I can't give you any water because you can't swallow properly. And you have to feed them through a tube through their nose or their stomach. Other thing is being unable to speak. That's one of the most catastrophic strokes, but some of these strokes could happen in the areas which control your speech center. Well, me and you were talking, they can't relate any of this. They sit there and just are there. They have primitive reflexes, can't talk or do anything on their own because it hit that area of the brain that controls all that. Not only are they not able to talk, but they can't understand what people are saying, and they're kind of just sitting there almost in a coma-like state. So the effects of stroke can go from just a mild weakness to a myriad where somebody's in a nursing home who needs a tube feed and somebody turn them every time and they have to use diapers to use the restroom. So it's a big picture between there. But these are hugely disabling, and they're a big burden on society and families as well. So that's why we preach to people, hey, you need to come to the hospital fast now so that we can do something about this, so you won't be one of those people who have the most disability from this. Because if you come fast enough, we could actually do something to help make it better so your disability chance is a lot lower.
Okay.
And one of the main things, like Dr. Smith was stressing, was getting to the hospital early. The medication that's available, we do like to treat patients, we say up to 3 hours, up to 4.5 hours. But the sooner you can get there, the better outcome you have, because we lose 1.9 billion neurons in our brain for every minute that we go without oxygen.
Wow.
So we want people to get there quickly. And now with the release of some new research that came out in January, we can treat these large vessel occlusions like Dr. Smith referred to that are the very devastating strokes. We can treat those patients up to 24 hours. Now, do we want to wait 24 hours? Absolutely not. The sooner the better. But there are some other treatment options, and one of the most common things that we do find, and I'm sure Dr. Smith will agree, is like he said earlier, patients sit at home and think, oh, it'll pass, or I'll wait till my daughter comes home, or I'll call her.
You mean when they start
when they start
these
experiencing
symptoms?
the symptoms.
They notice the symptoms, but they don't do anything. They think, okay, maybe it'll just go away, or maybe I can take aspirin and it'll get better. Instead of saying, hey, I'm going to pick up the phone, call 911 immediately and get somebody here. And that's what that's one of our big points we're here for today, is to stress to these people, like, if you have any symptoms, call immediately. Don't waste any minutes or seconds.
Don't be your own doctor.
Right.
Exactly.
And when the EMS comes on the scene, they actually start the process for us, so that's even better than if you have your family member bring you, because they can go ahead and get an EKG, and they can get lab work, and they can get an IV access for us. So once that patient reaches the emergency department, we're a step ahead in that whole treatment process, because we like to say we have 45 minutes from the time that patient arrives in the hospital until the time we get our complete workup and we administer our medication. And I'm happy to say that Medical Center was awarded yesterday from the American Heart Association the Get With the Guideline Gold Plus Target Stroke Honor Roll Elite Plus.
Wow.
That's the highest award that American Heart Association gives out, and we got that award for having the fastest, some of the fastest, what
Treatment
we call
times.
door-to-needle times or treatment
Congratulations.
times. For first quarter in 2018, we were able to deliver that medication in less than 41 minutes from the time a patient walked in the door.
Congratulations. You mentioned aspirin. Talk about that. Is there an advantage to it? I mean,
Typically, yes, there is an advantage to aspirin. Aspirin does help.
but not when you have a stroke. You know,
By the time you have the stroke, it's too late.
Okay.
So there's been debates over taking aspirin
Maybe
prior.
every day.
Yes, prior to having a stroke, and there's been no proof that it helps to prevent the first stroke. However, if you have a stroke, it's shown to prevent a second stroke.
Okay, so taking an aspirin won't necessarily
Prevent your
from
symptoms.
ever having a stroke.
Correct, but it will, for certain types of strokes, it will help prevent those.
Okay.
There's certain
It's good for your
strokes-
heart.
Exactly. It is good for your heart,
It
too.
is good for your heart.
Okay. So why don't we do this? I'm going to give each of you a minute apiece to just address the audience as it relates to, strokes and what should be done and what they should do. Whatever you think will be important, for the community to know. Because what we want to do, Doc, we want to save some lives, and we want to save some impairments, and we want to save some stroke, even if you repeat something that we've already mentioned.
I'm definitely going to repeat something that we already mentioned. And we're going to go back to FAST, so that's so important to us. So the main thing is to recognize that somebody has the symptoms. And once you recognize, you go through those steps of FAST, which is the first F, A, and S. If they have the facial asymmetry, arm weakness, or speech problems, those are immediate times to call the ambulance. Don't bring yourself to the hospital. Ambulance could get things rolling a lot smoother. And it's time that's so much important. If you come in the correct time, then we could possibly do something to help prevent any kind of disability long term. Second, I want to reiterate, it's so important to take your medication and go to see the doctor annually. Most people, we have a lot of people who don't even know they have high blood pressure or diabetes because they hadn't seen a doctor in 15, 20 years.
Oh, wow.
So that's the most important. The second most important thing to do is to make sure you see your doctor regularly so he can control those modifiable risk factors so we don't have to get to the state where you do have a stroke and we're trying to do stuff to reverse it.
Right. So the one thing that I did want to piggyback off of is we do promote FAST. We know that if a person has all three of those symptoms, the face, the arm, and the speech deficits, that they have about an 87% chance that they're having either a TIA or a stroke. But we also want to include those other signs and symptoms of a stroke that are so important. And that sudden weakness in the face, the arm, the leg, and it's generally on one side of the body. Sudden trouble with your vision, blurred vision, double vision. Sudden trouble speaking. Your words may not be clear. They may be slurred. They may be inappropriate. And then sudden trouble with walking. Maybe you walk and you lean to one side, or you have such weakness in your leg that you can't walk at all. And then most importantly is that sudden severe headache. And I'm not talking about the headaches that we have when our kids act up. I'm talking about the most severe headache you've ever in your life experienced. And that generally indicates a bleed in the brain, that hemorrhagic stroke.
Wow.
So yes, as FAST is important, and I want everyone to take that away today, but we also want to know that there are other signs and symptoms as well.
Well, I want to let everybody know how much I appreciate you all for coming on the show and imparting this very, very significant, important information. This is a call to action.
A call to
I've
action.
had the opportunity to interview Mr. Denise Goins and Dr. Matthew Smith, both of whom are very, very versed in stroke and its causes, etc. So, heed their advice, because we don't want one side of your body to be weaker than the other or having other symptoms. This is a call to action.
A call to action.
I'm your host, Alex Havisham. Have a great day. See you, doctor.